We spent over $500,000, if not more, on attorneys at that time to figure this out. My name is Colleen Carberry, and my husband is Dr. Mike Carberry, and we've had a medically integrated practice for 30 years. Now, I'll tell you this, it's a beautiful practice, helps so many patients, but it didn't start out that way. Let me tell you how it actually started. We had the idea to medically integrate. Now, our idea to medically integrate was to actually help more patients. And we thought, well, let's do integration. So we hired a medical person and kind of got started. Well, if there are landmines in integration, I think we stepped on every single landmine. After about 6 months, when the whole practice was balled up, we had not sent any billing out, we realized we needed help and we were in trouble. Once we figured out what needed to really be done, the foundation that needed to be in place, that we never actually put in place, okay? We ended up throwing out 6 months worth of billing. That was over $500,000 worth of income that had to be thrown out because we were not established correctly and our foundation was not correctly. And we had a choice. We either continued the way we were or we stopped, threw out $500,000 worth of billings and start all over. And that's what we decided to do. We learned a lot of what not to do, but we actually needed help. So we hired attorneys, we hired billing compliance people, billing attorneys, we hired healthcare attorneys, and they actually helped us lay out the foundation for what we needed to do to build a successful medically integrated practice. We spent over $500,000, if not more, on attorneys at that time to figure this out. You ask why? Well, what we knew was that our patients wanted more from our practice. We were seeing 750 visits a week, and our patients wanted more than what we had to offer. So we persevered, figured it out. Once we figured out our foundation, we still had to figure out the next steps of integration. So the next movement forward was, how do we actually run a medical office that's purposed, that forwards the cause of chiropractic, helps the patient, but actually puts together a team of healthcare professionals that work together for patient outcomes. Well, that was our next thing to figure out. And we went through a lot of practitioners. We had practitioners that wanted to write prescriptions. We had practitioners that wanted to do alternative things. We navigated those fields for the next year and got that all sorted out and figured out our way through that minefield. Mind you, we definitely stepped on landmines along the way, but we figured it out. And then the third phase to move into was, how do we actually scale the practice at that point? We had our foundation in place. We then figured out how to actually do the medical integration and work as a team. And then we had to figure out how to scale. And we did scale. When initially we took a hit on our practice, we were seeing 750 visits a week. We dropped down to like 400 visits a week. It was, for us, awful. It was awful. The practice was shrinking while we were trying to bring more to our patients. Well, when we got to the point on scaling, we went back up to our 750 visits a week as a medically integrated practice and actually created the impact that we wanted to create in our community. So kind of to recap for you, there were 3 phases that we went through. The first phase is what I call the foundational phase. This was the fact that the practice was not ready to medically integrate. We needed to put the foundation in with the staff, and we needed to put certain foundational elements in place to even put the integration on top of it. Once we figured that out, we then were able to bring in the medical team and put integration on top of a very strong foundation, at which point then we were able to offer more services. And once the team got in a rhythm, we were then able to scale. So at AMI, we actually offer our clients this 30+ years of knowledge, of mistakes, of solutions. We actually offer it to you. You don't need to make the same mistakes we made. Our program is broken up into 3 parts. The first part is the foundational part. We evaluate your practice and we put the foundation in place that you need. Doesn't take long at all. 8-10 weeks, that's all it takes for us to put the foundation in place. The beautiful part about that is that when the foundation goes into place, we usually see doctors double their income. That's right, you double your income. Because what we do is we take the inefficiencies in the practice that you have right now, we put some efficiencies in your practice. Most of our doctors double their income in 8 to 10 weeks. It's perfect. At that point, your practice is cash flowing. We then move you into the integration process. The integration process takes all 10 weeks, 12 weeks, at which point you're doing your first injections and your medical team is there, and then we're ready to move to phase 3. And phase 3 is where we double your income again, if not triple your income, because we will then scale your medical practice. So you don't have to actually step all over those landmines like we did. We did it for you. We took the scars, we figured it out and figured the path through that minefield for you. So just click the link below or above, find out if we can help you to put the foundation in and take you to be able to double, triple your practice. If you'd like to learn more, hit the subscribe button below or leave us a comment.